morning, Namibia, and a very warm welcome to today's information sharing session on this beautiful Tuesday morning, the 21st of November 2023. We are coming to you live and direct from the Government Information Center studios in the heart of the capital city, Windhoek. Now, for this morning, I am your host, Heleni Felepe-Samunyela, and alongside my four panelists, we'll be keeping you company between now and 11 o'clock. For this morning, we are discussing World Antimicrobial Resistance Week. And I'm joined in the studio by a team of well-versed experts from the Ministry of Health and Ministry of Agriculture and the Veterinary Services. Joining me from the Ministry of Agriculture, Water and Land Reform is Dr. Lee Monique Anderson. She is a veterinarian, Central Veterinary Lab. Good morning, doctor, and welcome to the Government Information Center.
Good morning.
And next to the doctor is Dr. Shivute Joseph, a medical doctor at the Windhoek Central Hospital at the Ministry of Health and Social Services. Good morning, Dr. Shivute, and welcome to the Government Information Center.
Good morning. Thank you for having me.
All right. Next to Dr. Shivute is Mr. Mwangana Movita. He is Head of Department in Pharmacology and Therapeutics at the University of Namibia. Good morning, Mr. Movita, and welcome to the Government Information Center.
Good morning, and a warm good morning to our viewers.
All right. And last but not least is Sister Maureen Hues. She is a registered nurse at infection control at Lady Pohamba Private Hospital.
Good morning.
Good morning. Good morning, Sister Maureen. Yes, Namibia, so if this is an area of interest to you, we are urging you, our viewers and listeners at home, to tune in and follow the discussion on our social media platforms. On Facebook, we are at Ministry of Information and Communications Technology. Otherwise, you can stream us live on our YouTube channel, and our handle there is MICT Namibia. Alternatively, you can call us at 1:30 and add your voice to the conversation. Now, Dr. Anderson, we start with you. How would you define antimicrobial resistance for a layman that is, the question is meant to be for Mr. Movita. How would you define antimicrobial resistance?
Thank you for the question. I would like to first begin by making the viewers understand what antimicrobial is. So antimicrobial is simply against microbes. And the microbes are what we commonly call the germs. So these include bacteria, fungi, viruses, protozoa, and these are disease-causing. They cause infections. Now, antimicrobial resistance, as defined by WHO in about 2001, is the ability of these microbes to multiply in the presence of antimicrobial concentrations which are higher than therapeutic concentrations. Just to make that very clear, when patients have an infection, we give them medicines, and those medicines produce levels in the bloodstream and other body fluids. So what we do to establish if there's resistance is to subject the microbe to even a higher concentration. Our expectation is that they should not survive. If they do survive, even at a higher concentration than we would normally give, then we would deem that to be resistance. Thank you.
All right. Dr. Shivute, the next question is for you. What are some of the misconceptions that the public have of antibiotics use?
Thank you for the question. There's quite a number of misconceptions that go around in the range from various to various misconceptions. The first and most common one being that antibiotics can treat every infection. It's a large misconception to a point where our patients come and demand for antibiotics for every illness. However, antibiotics primarily only treat bacterial infections. So you'd find patients coming in with a flu and they want antibiotics, or certain prescriptions for viral infections that have antibiotics in them. So that's the first misconception, in that antibiotics are primarily only for bacterial infections. Another misconception is that once one feels better, they can stop their course of antibiotics. If the course is written up for a certain duration, say for instance 7 days, even if you do feel better, it doesn't mean you are less effective, and you can still transmit these microbes to someone else. We need to complete our antibiotic courses for the duration that it's set out to. Even if you feel better after 2 days, it doesn't make you less effective. You can still transmit these microbes to the next person. As we discussed levels as Dr. Movita stated, that there's a level to kill these microbes, and it has to be maintained over a certain duration of time to make sure that these microbes that one gets rid of these microbes. Another misconception is that, or something that the public tends to do, is use of leftover antibiotics, and it's become a problem now, since we have patients that on complete antibiotics storage. Then they store it in cabinets. In almost every household, you'll find leftover antibiotics that are there, and then people tend to take these antibiotics when they feel ill, but then not knowing that each particular antibiotic targets a certain organism, and what you have might not necessarily what you have is not necessarily what that particular antibiotic treats, and then hence also leads to resistance. Another misconception is that you are no longer infective after you start taking your antibiotics. It's sort of just like you feel better after not taking your antibiotics. Also, after you start taking them doesn't mean you are no longer infective. So one needs to continue until the course is done. And then for our female viewers, there's also a misconception that antibiotics affect your birth control. So there's also a breakage in the course, because there's that fear of, if I start taking it, then I might become pregnant. And besides the one antibiotic that we call rifampin, that is used primarily for tuberculosis, there's actually no evidence that shows that your antibiotics does affect your birth control. So these are the common misconceptions that exist in our community.
Wow. Quite informative, and I must say, as a nation, we need to unlearn some of those misconceptions that we've been having. For example, if you take your medication for a week and it's maybe prescribed for 2 weeks course, and after a week you feel a lot better, you discontinue. So we need to unlearn that, and also the fact that you can still be taking your antibiotics and still be infectious, still have, for lack of a better word, still be in position to infect other people. Now, Doctor, this is a follow-up question for you, Dr. Shivute. Now, for a layman that does not understand the difference between a bacteria and a virus, because what I deduced from your response is that antibiotics do not cure they don't cure viruses. Is that correct, or did I?
Yes.
Okay. So for a layman in the street there that does not understand, what is then the difference between a bacteria and a virus? Are you able to answer that now, or should we let it slide a little?
Again, they are different, as you said, with their all of them are microorganisms, but within the spectrum of the word microorganisms becomes subdivisions, as it was earlier stated. There's the bacteria, the germs, there's the fungus, and then there's viruses. Now, all of these three differ in a structure, in their way of existing in the environment. So, and if they differ in structure, you cannot target that particular organism with medications meant for another organisms. That's why we have antivirals, we have antifungals, and then that are for the viral and fungal infections. And that's why we have antibiotics for the bacterial infections.
Okay.
So, yes.
Thank you, thank you. That is good to hear, and I'm sure the nation is learning a lot from this conversation. Dr. Anderson, how are animals and environment affected by AMR? Can you talk to us about that? How are animals and environment affected by AMR?
Okay, so similar to humans, the animals are mostly affected in their health. So due to AMR, we are having challenges with therapeutics. We have increases in animal losses and suffering and animal welfare. And apart from that, it also affects production in animal health. And this is something that's very important to the farmers. So it causes economic losses. This affects mostly our commercial farmers and also the livelihoods of people who do subsistence farming. So they farm to sustain themselves and their families, and with AMR and production losses, they are directly affected. Another way how the animal industry or sector is affected is food security and food safety at the end of the day. So whatever we put into our animals can later on end up in the food chain. So AMR poses a risk to our food chain, our food security. And how this comes together with the environment is basically the environment gives back to you what you put into the environment. So whatever we are putting into our animals and disposing of, the environment will bring it back to us in simple terms. So the environment, humans and animals are interlinked and interdependent. So what you put into your animal ultimately ends up in the environment, and this is because of the manure that goes into the soil, and then it can go into the water systems. So we are again all interlinked. So the environment is not only affected by animal health in that sense, it's also affected through poor waste management in general, poor sanitation, a few of the things that we can mention, and also waste disposal from medical facilities, animal health facilities. So those are basically the factors that interplay. In summary, I think that is how animals and the environment is affected, and mostly animals health-wise and production-wise.
All right, briefly put. Sister Maureen, we didn't forget about you. I would like to know, how would you define healthcare-associated infections and their relations to antimicrobial resistance?
Healthcare-associated infections are infections that patients acquire while they are in hospital. Usually it appears 48 hours after being admission. There must be an intervention or interaction between the patient and the nurse or the healthcare worker. The type of healthcare-associated infections that we find in a healthcare setting is SSI, we call it SSI, but it's surgical site infection. It can be VAP, which we call ventilated associated pneumonia. It can be CAUTI, which we call catheter-associated urinary tract infection, and then lastly, it is bloodstream-related healthcare-associated infections. All these, usually healthcare-associated infections, it's not mainly caused only by resistant bugs, it can also be caused by some very sensitive bugs. So healthcare-associated infections are very costly, it's hard to treat them, and mostly it prolongs the length of stay in the hospital. So we, as healthcare workers, have to break the chain to prevent patients to acquire these infections in the healthcare setting by simply to disinfect our hands between patients, which is very much important because that's the way we have to break the chain. And then proper waste management in a healthcare setting is very much important. If your waste is not segregated properly, then it can spread infections in the healthcare setting. The other method to prevent infections, also the spread of infection, is wearing of correct PPE, personal protective equipment. Through that, you can prevent spread of infections as well. Isolation is very much important. We have to isolate and we have to co-avoid the patients with infectious conditions. That is very much important. The other way is to clean the equipment between patient use. That's how we are breaking the chain. And the other way is sterilization of all the instruments that is being used on the patient. That's how you prevent healthcare-associated infections.
Okay. Now, Sister Maureen, I have a follow-up question for you. Now, in an event, hypothetically speaking, I am admitted, and maybe I see a nurse or a health worker comes in the room where I'm admitted, and I don't see any sign of them sanitizing or disinfecting their hands, and they come on to me. If I, at that point, make it a chance, if I communicate to them that they didn't wash their hands and I see maybe they are exhibiting signs of being offended by my remark, what is the next way forward, or who do I communicate to in that case?
Okay, currently in our hospital, the practice is we are having POS cards where the patients are rating the service. And one of our questions is, did the healthcare worker sanitize or disinfect her hands? So you have the right to put there whether the healthcare worker did that. If not, you have to approach and tell the nurse, because it's your right. It's your right. Tell the nurse, please disinfect your hands before you touch me. It's your right. Community has the right to do that.
Okay. All right. Now, Namibia, as earlier alluded to, this is a conversation of interest to all of us, as at one point we are all affected by antimicrobial resistance. So if you are tuned in now at 1:30, please feel free to call in the studio and ask your questions and get your answers from the horse's mouth, and add your voice to the conversation. Now, the conversation of today, or today's session, is also demonstrated by a lot of clips. We would want to share a video clip now with the nation to just provide you a more overview of what antimicrobial resistance is. Let's take a look. Now, Mr. Moveta, we start with you. What role does the university play in reducing antimicrobial resistance?
Thank you very much. The university has three missions. Number one is training. The second one is research. And the last one has to do with community service, which in recent years we are talking about outreach and engagement. So I'll get to training. So we are training healthcare professionals, would-be healthcare professionals. So in all their training, be it in medicine, in pharmacy, in dentistry, veterinary medicine, physiotherapy, there's a module that they have to do in pharmacology. And one of the central themes of these modules is an understanding of the appropriate use of antimicrobial agents, in which also there's emphasis with the scourge of antimicrobial resistance. So we are producing graduates who are already aware of this challenge of antimicrobial resistance. With respect to research, there's a lot of research and clinical audits that are taking place. So research in terms of producing antibiograms, which are used to guide appropriate antimicrobial therapy based on the resistance susceptibility patterns that we get in the hospital setting. There's also research, benchtop research at the level of discovery of newer agents that will be able to contain antimicrobial resistance. Obviously, these are studies which are still at a very preclinical stage. Then with outreach and engagement, in the past few years, and especially for the University of Namibia and the Faculty of Health Sciences in particular, there has been an emphasis on the university being able to relate with the community in which it exists. So this means reaching out to the community and the university not being far off the community. And in this area, I have an example. On Rondo campus, I think they carried out an outreach where they went into the community to just educate the community on appropriate hand washing. You'll notice that hand washing is a natural thing that we do, but there's actually an appropriate way of hand washing with all these steps that one needs to follow. So in a nutshell, that is the university's contribution towards fighting antimicrobial resistance.
All right. Dr. Anderson, what has the ministry, your respective ministry, done or is doing to ensure that the public is actually aware of antimicrobial resistance in animal health?
Okay, so the Ministry of Agriculture has done a few activities, but not in isolation. So we have worked in collaboration with few other institutions, organizations. Last year we started with annual AMR stakeholder meetings, which was our first one last year. We had another one this year. So this meeting has been in collaboration with FRI, and it's basically to create a platform for us to visit and our implementation status of National Action Plan, but not only that, also to create awareness at the same time, because we invite from the student, the farmer, until the experts in AMR. So everyone will be sitting in one room and have the time to discuss these matters or to clarify what needs to be clarified. Apart from that, we have also last year for the first time commemorated World Antimicrobial Awareness Week, similar to this year, where we have taken awareness material and messages to media platforms, and we have participated together with Ministry of Health in awareness walk and short commemoration activities. Apart from that, not only during Awareness Week, throughout the year, what we do is we have created awareness leaflets and posters, and this has been done again in collaboration with FRI, with the World Organization of Animal Health, Food and Agriculture Organization. With their support, we have made these leaflets. We have distributed them via medicine sales. So we do not have a lot of veterinary medicine distributors in the country. So the ones that we do have, we make use of them to distribute these leaflets together with sales of antimicrobials. We've also sent those out at regional level for veterinary officials to do one-on-one trainings. And we recently developed a short guide for farmers on how to rationally use antibiotics, how to store them in the correct manner, and we are seeking to have them translated now into local languages, and these will also be distributed to regional level and will be used for one-on-one trainings by our field colleagues. Apart from that, also throughout the year, what we do is we do farmers training sessions. So we make use of opportunities where farmers gather, like information days, auctions. We reach out to the farmers and we have these training sessions, and we have done this together with farmers unions such as the Namibian Agriculture Union, the Livestock Production Organization, AGRA. So whenever they get the farmers to come together, we sit and we discuss these matters. So in a nutshell, that is a few of the activities that we have done to take AMR to the public.
All right. It's refreshing to hear that you've actually thought of, translating the work in the vernacular so that there is no language barrier for the farmers that are non-English speakers or that don't understand or speak English per se. Now, Mr. Movita, what is the role of pharmacists, both in hospitals and retails, to combat AMR?
Thank you very much. So pharmacists play a pivotal role in containing antimicrobial resistance. And over the past few years, there's been a concept of antimicrobial stewardship, which pharmacists really do play a huge role in. And this is a concept where we have multidisciplinary practice, not only pharmacists, but also working with physicians, working with nurses, largely working with all healthcare professionals in optimizing outcomes out of the use of antimicrobials, delaying emergence of resistance, preventing the spread of resistance. So how pharmacists do this is that I think they participate at many levels. Number one, beginning at policy level, because you need to produce antimicrobial prescribing guidelines, for example, antibiotic policies that have to be followed and which make the practice really very easy for the physicians. Then pharmacists also play a huge role in patient education. So all patients who are on antimicrobial agents will need to be educated on their appropriate use by the pharmacist. And actually, this education only does not occur at the level of them receiving a prescription. For those patients who are in hospital, it involves inpatient education while they're still in hospital, up to the time that they leave the hospital. Yeah, so in a nutshell, that's the huge contribution that pharmacists make. Yeah, but maybe let me add also, not only the university, but the pharmacists also can do research within their practice setting. And this research generates evidence which informs how we can appropriately use antimicrobial agents. Yeah.
Okay. All right. Dr. Shivute, what are some of the consequences of AMR in human health?
Okay, thank you for the question again. There are really large and very detrimental consequences as a result of AMR. Starting from the first would be we have an increase in prolonged hospital stays. So diseases have become more difficult and expensive to treat. The longer you are in the hospital and while you're trying to treat this resistant bugs, and also at the same time when you're prolonged in the hospital, that means prolonged monitoring, and then there's also constant testing on the sensitivity of whatever disease you have to whatever antimicrobial is available. So that's one of the consequences. as I stated, also increased medical bills. If you can tell, if you are in the hospital for long, one can see how that would impact you financially as the prolonged stay, the medication, changing courses, and also another consequence of AMR would be now that our surgical interventions have become a bit tricky because the fear of resistance is so high, and there are post-surgical infections because now you have a patient that requires surgery, but then they're at risk of contracting a resistant superbug. So the risk of operations have also increased, and hence now intervention is a bit tricky when it comes to being surgical. We also have, as a consequence also, we now face a problem with previous diseases that were treated on an outpatient basis that have now become diseases that can actually become fatal, which could have been easily prevented by avoiding misuse of antibiotics or antimicrobials. So these are the consequences. We're actually at the point where we are returning to the point where we initially didn't have antibiotics because our options are now being limited in terms of what we can use, what's available, and the superbugs are growing in resistance. So these are some of the consequences that you may suffer from antimicrobial resistance.
Okay. I'd like to ask you a follow-up question. Do we perhaps have research centers in Namibia that are carrying out such research on this, such studies on this topic?
Yes, I think Dr. Movita highlighted on the university's role in AMR and research on the different types of antimicrobials and the effectivity towards the microbes. The facilities are available, but the concern is that the turnover of resistance is it's a bit more higher than the duration it takes for the research to actually find that appropriate antimicrobial. So you can imagine researching on a certain antimicrobial. By the time you're done with your research, it's already resistant. So that is the main focus. That is the main problem we have, and then a lot of effort should rather be put also into prevention, like Mr. Movita highlighted, on prevention and education and appropriate antibiotic use, and then the research also just adds on top of what you're already doing. So it has to be a whole collective effort.
Okay. Well, Namibia, you've heard from the doctor himself. I'm urging you to take or be part of this conversation. Join the discussion on our social media platforms. You can stream us live on our Facebook page. We are at Ministry of Information and Communications Technology, or you can stream us live on our YouTube channel. We are at MICT Namibia. Alternatively, you can call us now in studio, and the call-in number is 061 400 397. The call-in number in the studio is 061 400 397. Now let's have a look at another video clip. All right. Now, Sister Maureen, what barriers makes it difficult for or to improve awareness about antimicrobial resistance from the hospital point of view?
From hospital point of view is if there is no proper antimicrobial stewardship. If there is no appropriate one, then it's difficult. It's very important to be able to analyze the nurse. That's what I'm always telling the nurses. They must be able to analyze the results. If they receive a results, they have to know whether the patient is resistant or sensitive to the antibiotic that the patient is on, and then it needs to be changed immediately. So if that is not done, then the patient will just continue with the antibiotics which he or he is resistant to, and then it will also continue with that resistance. So the other challenge is if the healthcare worker are not compliant to infection control practices, if there is no proper hand facilities in a healthcare setting, it's another thing that can contribute. And then the other challenge is the overload, the workload. The other challenge is if there is no enough beds in the healthcare setting, the spacing, the cohorting, the isolation facilities, that's also another challenge. So those are mostly the challenges that we are sitting with.
All right. Mr. Movita, what barriers makes it difficult to improve awareness about antimicrobial resistance from the university point of view?
I think at the level of the university, it's not huge. We don't have many barriers because speaking for the Faculty of Health Sciences and Veterinary Medicine, antimicrobial resistance is entrenched in the training. So at that level, we have these students who then also propagate the message to the community. Obviously, over and above that, the university can obviously do a lot more in outreach and engagement, getting into the communities. So it's a balance between the other functions of the university, that of training, that of research, but also having, I think, more effort directed towards the university beginning to reach out to the communities as well, supplementing the efforts of the Ministry of Health and Social Services. Yeah.
Okay. All right. And Dr. Anderson, from the Veterinary Services point of view?
In veterinary medicine, I think it's somewhat similar to that of human health, apart from the fact that we have antimicrobials available over the counter, antibiotics specifically. So this creates a problem because where the farmers acquire these over the counter antibiotics, there are usually no healthcare or animal healthcare workers at these retail centers. So it basically makes us miss out on the opportunity to have that one-on-one with the farmer and to discuss on how they should be using it. And at a regional level, basically in the field, it's also like how Sister Marina said, human capacity and workload. Going out into the remote areas, we do have a lack of staff to go out to all those remote areas and do outreach.
All right. Dr. Shivuta, would you like to expound more from the hospital point of view?
Yeah, on top of what Sister Maureen has said, also interdepartmental-wise, our pharmacists and doctors, the assumption is, and this often leads to patients not also understanding their medication properly. You always assume as a doctor that the pharmacist is going to explain how you're using the medication, the appropriate use of your antimicrobials, and then they also assume, well, maybe your doctor has told you that this is how you're supposed to use it. So interdepartmental collaborations, health education, most of the time we are overwhelmed, and we focus on, as a third world country, we focus on a lot of other diseases, and we don't often put enough emphasis on antimicrobial resistance. So our hypertensions and other non-communicable diseases, you would find a flyer or a poster everywhere, but not enough information about antimicrobial resistance. Although there is an effort, we just need to increase that effort and also reach out to the community and provide the adequate education on antimicrobials, because that's where the main source of the problem is. And by the time it comes, people are often already resistant to certain bugs. So, yeah.
All right. Okay. Sister Maureen, what should the community members do to reduce the emergence of AMR?
It starts with prevention, as mentioned already. Prevention is the cure. So, for instance, kids must go for vaccinations, which is very much important. If you know some family member is having TB, just be in a well-ventilated area, and you advise. You have to tell your family member to complete the treatment, the course, for the 6-month course. He shouldn't stop in between if he feels better. He has to take it on the required times, which is very much important. So prevention is the key. I think we must start there. And the community was actually doing very well with COVID. They follow most of the precautions. So I think that's the same.
Absolutely, absolutely. Dr. Anderson, what can farmers do to foster responsible antimicrobial use in animals?
Okay, I think, again, just going back to what Sister Maureen said, it all starts with prevention. So this is also what we encourage farmers to do. We always speak about prevention, and we encourage them to rather prevent the disease than having to cure it, to improve biosecurity on their farms, and to vaccinate as far as possible. We always try to send out the message that there is a big difference between a vaccine and an antibiotic, because it's still being misunderstood. And we have farmers administering antibiotics to healthy animals. Some do so purposely, and others are not aware. And when they do this purposely, they do it for prophylaxis or metaphylaxis. My neighbor's animals are sick, so let me just give some just in case. That is one of the biggest things. Also, I would say farmers should try to reach out to their veterinarians as much as possible. They're not doing so enough, and because these antibiotics are available over the counter, they seek the antibiotics themselves and administer according to how they are used to doing it. If you are unable to locate or to contact your local veterinarian, make sure to look at least at the package inserts. There are instructions, stick to the doses that are recommended. They have been set there for a reason, not to give less than what has been prescribed, and give them for as long as it has been prescribed. If you need to give it for a certain period, complete the course. What we always say is that use as little antibiotics as possible, but also use as much as necessary. So use just enough for the time period as it's necessary. Those are a few things. Something else that also needs to be spoken about more, I think, is on how they dispose and discard of the unused antibiotics. It gets stored in the cupboard at home, the expired ones. So if you are unsure of how to safely discard these antibiotics, make sure to reach out to your healthcare facilities or to your local veterinarian, your pharmacist even, to know how to properly discard these and not just have them go down the drain and end up in our water systems. So these are a few of the things that we want the farmers to know. And again, just to emphasize, prevention is better than cure, and a healthy animal does not need an antibiotic.
Well put. Now, Dr. Shivuta, similar on what Dr. Anderson have just alluded to now. You find sometimes somebody is sick, a person is sick, and they would want to acquire maybe an antibiotics over the counter, and they quickly go to the pharmacy and want to get something. Do we actually get antibiotics over the counter for human?
The antibiotics are they are supposed to be prescription-only medication. So if there is a way that they are acquired, then it's not in the legal framework. So if you're sick, you will need to be properly evaluated, and a proper assessment needs to be made with a proper diagnosis, and then only we can decide whether you do need whether your disease does warrant an antibiotic or not. And then a script is written up, and then the pharmacist can issue it. But even before the pharmacist can issue it, they also see if the appropriate medication is written for the appropriate assessment or diagnosis, if it's within the scope, if that particular antimicrobial does cover that particular disease with the microbes that are within our setting. So it's a lot of proofreading that's also done. So yes, in summary, you cannot get antibiotics over the counter.
All right. Now, we are slowly coming to the end of our discussion today. I would like to ask Sister Maureen, do you perhaps have final remarks for the Namibian nation as far as antimicrobial resistance is concerned?
Let's protect what we are having.
Okay. Short and sweet.
Sure.
Okay. Mr. Movita, what are your final remarks for the day?
Final remarks. One, antimicrobial resistance is real. It is not far off. It is here with us. And also what I would like the viewers to really appreciate is that all of us are potentially patients, because we can all be patients. And therefore it requires concerted efforts from every member of society, because we are all affected by antimicrobial resistance.
All right.
Yeah.
Dr. Shibuta, your final remarks for the day?
Antimicrobial resistance is potentially the next global health crisis. Misuse and overuse is a modifiable risk factor to antimicrobial resistance. So it is a factor that we can change through the various efforts that were discussed here on this panel. So let us not reach a point where a simple cut over the skin becomes fatal because we are out of options to treat you. So I urge the public to do their part, and I also urge the healthcare providers to provide the public with the necessary information, and also to necessary prescription to the necessary disease. So yes.
Okay, all right. Dr. Anderson, you have the final word.
Okay, I would just like to say to the public that it all starts at home. So we do not have to wait for healthcare professionals, animal health workers to start putting it out there. We can start at home by doing basic practices like we have discussed today, just how to use the antibiotics, discarding them off correctly, and the prevention measures. That's all I have to say.
All right, thank you. Now there you have it, Namibia. That is all the time we had for today's discussion. We were discussing World Antimicrobial Resistance Awareness Week. And join us again next time when we unpack another fruitful discussion here at the Government Information Center. From myself, Hileni Felipe Samunyela, and the entire GIC production crew. Until next time, goodbye, Namibia.